go into preparing for surgery. Some of the things are you going to your doctor, we're asking you to get these blood work results and things like that. We look at our hemoglobin, which is telling us how much of our red blood cells are in our body. When you have surgery, you're at a risk of some blood loss. It's very small, but you still want to have that number optimized. The second thing we look at is your hemoglobin A1C. That's telling us a kind of trend of your blood sugars over the last 3 months. People who are diabetic or have an A1C that is high, so over 6.7, that's going to put you at an increased risk of infection. We're looking to make sure that it's not higher than 7.5, which is our cutoff. Other things we look at in this same respect is called fructosamine. So that's a number we're looking to see if it's high or regular. So if it's high, that's telling us that your blood sugars have been elevated over the last 2 to 3 weeks. And so in that same vein, it's telling us whether you're at risk for infection after surgery. The third thing we look at is albumin, which is telling us if it's low, that's also putting you at a risk for infection after surgery. Fourth thing is vitamin D. Living in these Michigan winters, a lot of people have low vitamin D. We found that if it's low, you're at a bit higher risk of having increased pain after surgery or post-operative complications. So we try to optimize those vitamin D levels before you have surgery. The last thing is we have you get a nasal swab. And what that's looking for is bacteria in the nose. If you have staph in your nose or staph that's resistant to penicillins or MRSA, that's telling us that there's a little bit increased risk of infection after surgery. All of these lab work results, along with things such as your allergies, your smoking status, whether you're taking any sort of blood thinners, and your clearances from your family doctor and your specialists such as cardiologists or pulmonologists, give us an idea of how optimized you are for surgery so that we can minimize any complications after.